The classical vaccines, they stimulate the adaptive immune system, which is mainly our lymphatic system, and it has memory. And usually they're long-lasting. Some of them are lifelong, like measles. Some are some few years. There are many examples, but we don't like them when they're less than a year, like influenza. Now, there's always reason to have concern when it's a first time. This is a simple virus. But now the question comes, what are the candidate vaccines? There's about 150, 160. Essentially, they're all the same. Now, I don't say I wouldn't go forward with this. I do say there should have been and needs to be a plan B. And I would call what we're doing really a plan A. We're proposing stimulating the innate immune system. The innate immune system is something that we all have. We might call it our alarm system, our emergency system, and it works in helping us stop virus infections.
So how are you suggesting that this innate immunity be stimulated?
It's an old vaccine, the oral polio, developed by Albert Sabin in the 1950s. Between 1962 and the year 2000, in America, everybody got the Sabin oral polio vaccine, and quite safely. It goes back 70 years. But then the season of heavy outbreak of influenza, in the people vaccinated with oral polio, they didn't get the influenza. To be exact, it was reduced 3.8-fold, 380% reduction, better than the influenza vaccines themselves. And then people saw the same thing could be done with measles vaccine, a replicating, safe, because it's modified, it's genetically different, it doesn't cause disease, and they got a whole host of childhood virus infections that did not occur. So it's broad in its activity. It's safe, it's readily available, it's cheap, like 10 cents a pill, easy to take, a little pill on your tongue. It used to be a sugar tablet.
But just to be clear, even if this were to work against the new coronavirus, and clearly, I understand that you're at the moment surmising that it probably would have some effect. Is there a danger at all that people, if a system were set up where, billions of people did take this booster and in order to try and boost their immune system, that they might then think, we're fully protected, and that could then lead to problems in itself?
That's true for any vaccine, wouldn't it be? Any new vaccine that comes along, you're going to have the same problem. It wouldn't be unique for this. I'm confident it's going to work. I mean, am I absolute? Of course not. I'm not absolute about anything in science or anything, period. However, the data are overwhelming in the experiences where it has been tried. It's going to work. One important question is, how long will it last? Well, we don't know how long the classical vaccine using the spike will last, but the evidence is that it might be less than 6 months. However, you can give this repeatedly. I think with stimulating repeat stimulation with oral polio, we could get to 6 months. There would be a dramatic difference and buy you time, get people back to work, and allow the adaptive immune vaccine to be developed. But the very same questions you asked me need to be asked of any vaccine that's new, correct? Let's not pick on oral polio vaccine for that question. It's true of any.